Hello, Dazzle. Thanks for coming and hanging out with me today. I am glad that you are here. So, today I am going to be talking about a sacroiliac joint hip support belt. So, this belt is designed to stabilize the sacroiliac joint, which can be a source of pain for many people. In this video, I'm going to be taking a look at a specific belt, how it works, and I'm going to let you know what I think about it. And I'm going to include a link to the particular belt that I am talking about that so that you can follow that link and take a look and check it out if you are interested in seeing this specific belt that I use. So to start off, the sacroiliac joint is a small joint that is located at the base of the spine, and it connects the spine to the pelvis. And this joint can become inflamed. And it's most commonly inflamed due to either immobility or hypermobility. And if it's because of hypermobility, it's usually because of some type of connective tissue disorder. And if it's because of immobility, it is most commonly because of osteoarthritis. So, in either case, it's where the joint is supposed to have a certain amount of flex, and when it isn't allowed to flex the way that it should, the joint becomes inflamed. The most common symptoms for sacroiliac joint inflammation are low back pain, and you get sensations that are in the lower extremities that can be numbness, pain, tingling, leg weakness, pain in your pelvis and your buttock, pain in your hip and groin area, feeling that your legs are unstable, which they just kind of buckle or give away, having difficulty sitting for long periods of time, or difficulty sitting with weight on one side. You get more pain as you sit for longer or for standing long times, and that you get increased pain when you are climbing stairs. So all those are signs of having in a sacroiliac joint inflammation. So sacroiliac joint belts are designed to help stabilize the sacroiliac joint and to reduce your pain. The particular belt that I use is made of breathable fabrics, and it has a dual belt design that provides controllable compression. So it has a base belt, and then it has two side belts that you can then use to tighten and control how much it compresses. It also is perforated to allow the air and moisture to pass through, which makes it a little bit more comfortable to wear. So, given that the belt functions by increasing stability at the sacroiliac joint by applying a compression therapy, it's not really the proper treatment if the sacroiliac joint pain and inflammation is being caused by immobility. In cases of immobility, this belt really actually could make the problem worse. So, I mean, like, really, with every medical problem, it really is advisable to seek your doctor's advice and try to sort out what's causing your sacroiliac pain so that you can sort out what is going to be your best pain management options. I mean, one benefit of this belt is that it really is a low risk option. It might not improve your pain or make your pain worse, but if it does, you can just stop using the belt, which makes it safer than a lot of the other treatment options that are out there for sacroiliac joint pain, which includes medications, manual manipulation, sacroiliac joint injections, and even surgery. The other lower risk options are like heat, ice, and resting the area. So, what is perhaps the most important thing to note here is that there really is very little research in the area of sacroiliac joint pain and inflammation treatment. And this means that there are no clear risks and benefits for any of the proposed treatment options for sacroiliac joint pain and inflammation. And this means that it's going to be really difficult to know for sure when any of the long term risks and benefits for using any of the treatment options, including a sacroiliac hip belt, would be. So, Management of this condition is largely focused on quality of life metrics because that's really the only factor that can be judged at this point, and it's going to be based really person by person. And as far as considering this particular product is concerned, I find it to be a good value for the money that you're spending. It works exactly the way that it is designed to work, exactly the way that it's advertised to work. I've owned the belt for several years now. It's stood up well. I use it intermittently though. Um, it does, in fact, stay put even when I have worked a 12-hour shift while nursing. The moisture wicking layer does work really well, which is an important feature because the belt is really warm and it leads to sweating underneath the belt. The Velcro and the elastic in the belt have stood up really well. They're very high quality. They function just as well as they did when I first got them. Um, I have been able to hand wash the belt and lay it flat to dry without any issues, which is another really nice thing about this belt. So if you are going to get a sacroiliac joint support belt, I would recommend this one. So, well, that's about it for my rambling today. If you like the video, please click the like button. It really does help. And until we hang out again, you guys be sure to take care of yourselves. Bye.